The pandemic and a new study tonight on mixing and matching vaccines coming on the eve of a key FDA advisory panel meeting on booster shots. The preliminary findings from an NIH study indicating that getting a booster different from your original vaccination is likely safe and effective. And what the research shows about following a Johnson & Johnson shot with either Pfizer or Moderna. And up next for that FDA advisory panel, Pfizer's vaccine for 5 to 11-year-olds. The White House telling governors to get ready to vaccinate kids in that age group early next month. The Biden administration also announcing the reopening of border crossings with Canada and Mexico, the U.S. welcoming vaccinated travelers next month as well. One more sign that we may be turning the corner. Here's ABC's Stephanie Ramos.
Tonight, preliminary results from a highly anticipated study finding that when it comes to boosters, mixing and matching vaccines is likely safe and effective. The study from the National Institutes of Health looking at Moderna, Pfizer and Johnson Johnson, determining that no matter the booster, all study participants saw a substantial uptick in antibody levels after a booster shot. And for those who got the Johnson Johnson shot, the study finding antibody levels were higher if they followed it up with Moderna or Pfizer versus J&J.
While this is really exciting, it's based on very small sample sizes. So it gives us a window into data that we'll see over the coming weeks.
But antibodies are only one part of immune protection, and the study did not measure precisely how well each booster protected a person. Mixing vaccine boosters is among the data to be presented over the next 2 days as an FDA advisory panel votes on whether to authorize Moderna and J&J's boosters for those 18 and over. Tonight, the Biden administration's booster rollout off to a good start.
By the end of today, we estimate that over 7 million Americans will have gotten their booster shot, including about 3 million just in the last week.
And in a return to normalcy, the U.S. reopening its land borders after nearly 19 months, allowing fully vaccinated tourists and other non-essential travelers to enter from Mexico and Canada starting in early November. This comes as the White House told governors in a private call to prepare to start vaccinating children ages 5 to 11 in early November.
1, 2.
Officials say they have enough Pfizer pediatric doses for the 28 million eligible children, pending authorization from the CDC and FDA. The doses, about a third of what adults get, to be distributed in 100 dose packs to pediatricians, hospitals, and pharmacies.
We'll make it convenient and easy for parents and kids to get vaccinated. We have the supply, and we will be ready.
In Virginia, just a day after her daughter's funeral, Nicole Sperry speaking at a school district meeting pushing for safety measures to stay in place. Her 10-year-old daughter, Teresa, died just 5 days after showing symptoms from COVID.
COVID is real, and our wish is that people take it more seriously.
The virus still having a devastating impact on families. Stephanie Ramos is back with us now here in New York. And Stephanie, the next 2 days will be critical with an independent FDA advisory panel meeting on those booster shots. Give us a reality check of what we can expect.
The FDA panel is expected to meet this Thursday and Friday to talk about Moderna and J&J boosters. For now, FDA advisors are planning to weigh in on whether to authorize an additional dose from the same vaccine maker. That new study offering early reassurance that mixing and matching appears to be safe.
We'll stand by for news on that, Stephanie. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.